You're over 60 and you figure you'd know if something was wrong because it would hurt. But surgeons who treat colorectal cancer see the opposite again and again. Pain is almost always the last thing to show up, not the first. This isn't rare. It's happening to people just like you, right now, often without them even noticing. A small change in the bathroom, a little more tired than usual, nothing loud enough to interrupt your week. By the time pain shows up, the tumor has often already grown large enough to press on something else or block part of the bowel. Colorectal cancer is now the leading cause of cancer death in adults under 50, and screening rates are still too low, even for people well past 50. Many people wait months before saying anything to their doctor. That gap is where the real danger lives. Today, I'll show you what surgeons really listen for before they even examine a patient. It's rarely the symptom you'd expect. My name is Dr. Emma Johnson. This channel has one goal: help people over 60 understand what the research really says. In plain language, no fear-mongering, just what the evidence actually shows. Today, I'm walking you through 3 signs colorectal surgeons watch closely. Stay with me through all 3. Sign number 2 is the one almost everyone misses. It doesn't hurt. It doesn't look serious. Most people never think twice about it. Sign number 3 matters most. When it shows up, your body is quietly telling you something. It's losing something it can't spare. Not today, not this week. But eventually, before we get into the 3 signs, you need one idea first. Without it, none of this will make sense. I call it the return rule. Think about anything strange your body does. One time, it usually means nothing. Most one-time symptoms are nothing. That's normal. But here's what changes when it happens again. First, one loose stool means very little. Second, loose stools that keep coming back over weeks mean something is happening. Third, doctors don't trust one moment. They trust a pattern. It's the same reason your doctor asks if this has happened before, instead of just asking what's wrong today. That's the return rule. Keep it in mind as we go through each sign. Sign number 1, the symptom that returns. Let me tell you about Diane. She's 61, a retired schoolteacher from Ohio. She loves her Sunday morning walks, 3 miles, rain or shine, with her neighbor's dog. One morning she saw a small streak of blood. She thought it was a hemorrhoid. She moved on with her week. Then it happened again, and again, over the next 2 months. Here's the problem. Blaming it on hemorrhoids sounds reasonable. Hemorrhoids are common. Most bleeding really is caused by them. But here's the twist. Hemorrhoids and early colorectal cancer can cause the exact same kind of bleeding. You can't tell them apart just by looking. Not without a proper exam. That's the whole point. Looking isn't enough. Testing is. A 2024 study looked at over 25 million patients under 50. It appeared in JAMA, a major medical journal. The finding was clear. Blood in the stool was the most common warning sign in that age group, and it often took months to get diagnosed. Other research backs this up. Patients in a Spanish study waited over 7 months on average, even with clear symptoms. What should you do instead? One bleeding episode is worth mentioning to your doctor. A second or third episode in separate weeks is worth a real conversation, not another guess. Sign number 2, the sign that doesn't hurt at all. This one catches almost everyone off guard, including Diane. She never had stomach pain, not once. She felt totally normal in every other way. Here's the problem. We're taught that pain means trouble, so no pain must mean no problem, right? But early colorectal cancer is one of the quietest conditions in medicine. It can sit in the colon for months, sometimes years, without a single ache. That's exactly what makes it dangerous. The colon has far fewer pain receptors than other organs, so it can hide a lot before anything ever hurts. A 2024 American Cancer Society report found something powerful. When colorectal cancer is caught early, before it spreads, the 5-year survival rate is around 95%. That's nearly everyone. But 3 out of 4 cases in adults under 50 aren't caught that early. Why? Because people wait for pain that may never come. What should you do instead? Don't use comfort as your reassurance. Use a calendar instead. If a bathroom change, bleeding, or fatigue lasts more than a few weeks, that's your signal, no matter how fine you feel otherwise. Your calendar doesn't lie to you. Your comfort might. Sign number 3, the one I never ignore. A few months after her bleeding started, Diane felt unusually tired, even after a full night's sleep. Her doctor ran routine blood work. Her iron was low. She hadn't changed her diet. She'd also lost a few pounds without trying. Here's the problem. Fatigue, mild weight loss, and low iron each seem small on their own. Easy to blame on stress, or aging, or a busy season of life. But when a surgeon sees all 3 together, it stops looking like coincidence. It starts looking like a pattern. Your body slowly losing resources it shouldn't be losing, the same way a leak drains a tank over weeks, not all at once. A 2020 study looked at nearly 2 decades of patient data. It appeared in Goot, a respected medical journal. Researchers found something specific. Unexplained low iron, what doctors call iron deficiency anemia, often showed up together with rectal bleeding. This combination was common in younger adults later diagnosed with colorectal cancer. They were careful to note the exact risk from these 2 symptoms alone is still being studied. Weight loss is a bit different. On its own, it's one of the most well-established warning signs in cancer medicine, backed by decades of broader research. So when fatigue, low iron, and weight loss show up together, doctors take notice. What should you do instead? If blood work shows low iron with no clear reason, ask directly about a colonoscopy, especially if it comes with fatigue or unexplained weight loss. Now, let's be clear about something important. Most bleeding really is just hemorrhoids. Most fatigue really is just fatigue. Most low iron has nothing to do with cancer at all. The return rule isn't about panic. It's about one thing only, not ignoring a pattern that keeps repeating week after week, even when each single episode feels small. That's the whole idea in one sentence. I promised you something you can use, so here it is. Step number 1, track, don't guess. If you notice bleeding, a change in bowel habits, or unusual fatigue, write down the date. Use your phone notes if that's easier. 1 entry means nothing. A second entry, 2 or 3 weeks later, means it's time to call your doctor. Bring that list with you. It's more useful to your doctor than trying to remember dates on the spot. Step number 2, don't wait for pain. Early colorectal cancer is often painless. Feeling fine isn't proof you're fine. No pain doesn't rule anything out. Remember, Diane, step number 3, ask about screening at 45, not 50. In 2021, the U.S. Preventive Services Task Force lowered the recommended screening age to 45. That's for average-risk adults. They still strongly recommend screening through age 75. If you're over 60 and haven't been screened recently, that conversation is overdue. Don't wait for your next annual visit to bring it up. Bring it up yourself, this week. Diane's story ends the way we want every story like this to end. Her bleeding kept returning, so she didn't let it go a 4th time. She got checked. The cancer was caught early. It was removed with surgery alone. No chemotherapy needed. 6 weeks later, she was back on her Sunday walking trail. Same 3 miles. Same neighbor's dog trotting beside her. That's not luck. That's what happens when you trust the pattern instead of waiting for pain.